first thing to be very clear about is what the treatment outcomes are. You need to understand what the treatment can and can't do for you, and that's very important. The treatments will not help existing symptoms. They will not repair any disability that you already have, but of course they will address future relapses that you may have had. They will reduce those, and in some cases they can affect the disease progression that you would have had. So it's important to understand how the drug works. If you feel, despite knowing what the drug does, you still feel you're not responding, then you go and talk to your MS team about that. But to do that, you need to be very clear on what your disease history is. I think you also need to consider that if you've only been on the drug for up to 6 months, for example, we cannot say whether you are or not responding to the drug. We like people to be on the drug for at least a year before we know whether they are responding to it. And response to the drug means that your relapses have been reduced. Another way that we may check the response that your disease is having to the drug is an MRI scan. Most centres, not everybody, but most centres will scan you once every year, once every 2 years to check whether there's disease activity going on. We can, on a scan, we can see whether you have had a new MS lesion in your brain over a period of time. So if you have had a new lesion and you have been on the drug for more than a year, it may well mean that we need to swap you to a different drug. We're all individuals. Some drugs work for some people and they don't work for others. No longer is it one drug and that's the only choice you have. If you're on a drug but you're still relapsing, then we will talk to you about swapping your drug to another one. It may well mean that we do what we call an escalation of therapy, so we put you on a slightly more potent drug, and then of course you will have to think about the side effects of that drug before you make your decision to escalate on treatment.